there's this middle layer of, unfortunately, what I would call public health experts, for a better word, who've been enlisted to distort and make claims that actually aren't true.
Good clinical practice, at least its part in which you deal with the community and seek their informed consent, seem to be rooted or originating from the past experiences.
Conversations like this are absolutely essential, I think, to reassure the public that, vaccines are good and we're always trying to make them better.
In some parts of the world, poor vaccinators really put their lives in danger, and there is so much backlash, sometimes violence, coming from the public.
Any doctor who tries to discuss risk-benefit of these vaccines with a patient, and if they try to discuss it on social media, will lose their medical registration.
Dr. Petrowski, wonderful discussion, and always, it's not an easy topic. It's such a complicated discussion, vaccines as a product and vaccination that in itself is like a small microcosm of the state of global health today. I just wanted to touch upon what you discussed, the today's discourse or the temptation to see black and white. Is this something that is also driving um, the polarization behind vaccinations? We see so much, like, such polar opposite views, and they're so loud. And what fascinates me, that both sides are citing data. One side is citing that there is no data, for example, while the other side, the opposing side, would be saying that we have the data, but the data somehow is invisible. And I would just add to it another thing that I was wondering earlier today, that pharmaceutical industry, biopharmaceutical industry, and developers are probably one of the best and the most advanced and the most well connected and the most well resourced, all adjectives, superlatives you can add to them. They have incredible data with them. They, to me, seem just very silent. Maybe it's something that you're alluding to, that these discussions are not as simple as they sound, and you discussed the safety aspect earlier in this discussion. But there is like almost a silence from the vaccine developers, although they are the major stakeholders. If they come up with something or some facts or the results of their experiments, they can maybe put this entire thing to this polarization and these ambiguities and skepticism to rest. Because ultimately, to me, it sounds that it is in their own interest. Of course, they're the developers. They would like to make their product a commercial success by showing more transparency and showing more data. So, just if you could clarify this, what is in my mind.
Yeah, look, that's a difficult
Right.
discussion to have because ultimately, they're doing it by and large for profit. So they have a conflict to start with, and they may understand some of the nuances. So
Okay. I don't want
in
to
other
put you
words,
in
well,
in
no,
a
no, in other no, it's an interesting scenario because I think this is what we're seeing is that, as you say, they're very knowledgeable, so they are best aware of some of the truth of some of these issues, or is there data or no data behind some of the claims, and the reason they're silent is because if they speak out, they have two choices. One is not to tell the truth. All right,
okay.
but you can be caught for not telling the truth,
Right.
or they can tell the truth. But if they tell the truth, they might have to qualify a lot of and to say actually, it isn't as clear cut. It isn't as black and white.
Right.
It isn't just this is 100% safe and effective. We'll have to tell you all that we know about where it isn't effective and where it isn't safe. So
Right.
I think they've made the decision better to be silent and have this other layer of people who you might call public health, or epidemiologists,
Right.
who can lie to the public if that's what they choose to do, or distort the information to the public in the public's interest as they would see it. And that won't then harm the company or their product. In other words, the company is happy for an epidemiologist to say, look, this company's vaccine is 100% safe and 100% effective. Now, clearly that what they're saying is not true, all
Hmm.
right? There's no such thing as any medical product that's 100% effective or 100% safe. It's scientifically, you can easily prove that that is not true. In other words, and if it's not true, that's a lie. So
Hmm.
they'll let these, public figures who are working for government or, working for various private organisations to get up there and make these grand statements. And almost the companies hide behind that. Often you'll find that the companies are funding those organisations that those experts are being paid through. But it's not the company executives themselves who are making, because they know that would be lying, and ultimately,
Right.
a big company gets caught for lying. I think Pfizer's been fined billions of dollars where they have been caught misrepresenting and lying. So they're very careful about that.
Right.
So I think the problem now is that there's this middle layer of, unfortunately, what I would call public health experts, for a better word, who've been enlisted to distort and make claims that actually aren't true, that are exaggerated. And I think the public now is starting to become aware that's what's happening. Because everyone, it's so easy to see ultimately that statement can't possibly be true.
Hmm.
Do you know what I mean? And if you have some leading public health figure making a statement that you clearly is just falsifiable by anyone, you don't need to be a scientist to know that can't possibly be true.
Right.
Then they say, well, what else have they said that isn't true? And so suddenly they go, well, I don't believe anything they're saying is true, which means I don't believe anything that any public health authority is saying is true, right? They're all liars, and they're just trying to trick us. And what happens then is basically the public no longer listen to any public health messaging.
That's
They just
unfortunate.
shut their ears and go, look, you're not going to, you tricked me once, you're not going to trick me twice. And so this is, and this we know from history, this is what happens. And it's difficult because, as I say, once you've lost the public trust, it's very hard
Yeah.
to regain.
Yeah, yeah. And if there could be an example of a truly global health issue, this is what it is, this debate on vaccination. I mean, in some parts of the world, poor vaccinators really put their lives in danger, and there is so much backlash, sometimes violence, coming from the public. I have to recount, though, my experience, and it goes back to what we discussed in earlier programs. It's the public health people or the global health people not really going out there in the public, in the community. The good clinical practice as a training, I found it very stimulating when I started my work as a phase three clinical trial researcher, particularly in the vaccine part, because the good clinical practice, at least its part in which you deal with the community and seek their informed consent, seem to be rooted or originating from the past experiences. And it really makes sure, if you get to the spirit of it, that you respect the rights of the public and give them as much decision making time, and what are the alternatives that they can come back if they change their mind.
Yeah. But
It,
what you're
that
talking
helps.
about is personal contact and informed consent, and both of those things were removed during the pandemic, if you'll remember. So first of all, they disenfranchised all general practitioners, who are the people that the patients trust, and they said general practitioners aren't allowed to discuss, vaccine safety or risk benefit with patients. Like, this has been decided by Big Brother. This has been decided by the public health experts. So they said, in fact, any doctor, and this I think was true in many countries, certainly Australia, any doctor who tries to discuss risk benefit of these vaccines with a patient, and if they try to discuss it on social media, will lose their medical registration.
Incredible.
And so, that they removed the mechanism of trust. Like, it's sort of, that's what's was insane about it,
Hmm.
is that, the very person that the patient would trust, and as you say, because they have to trust them, they are the person who gives them all their medical advice, and they've learned to trust them over long periods of time and know that they're honest. Otherwise, you change your doctor. So
Right.
you trust your doctor implicitly. Everyone does.
Absolutely.
Um, but the authorities, in their wisdom, said, no, we don't want doctors discussing those issues with patients. We don't want to. We want to bar them from being allowed to actually express their opinion, because of course some doctors thought some technologies were not developed enough, or the risk benefit wasn't in favour. They had a young patient, for instance, who had minimal risk
Right.
of from COVID, and they might advise them, look, I don't think you need to have this vaccine, but the government were mandating it. They were
Right.
forcing everyone to have it. And to do that, they removed the doctors from the equation, said doctors aren't allowed free to speak freely to their patients on it. I mean, that was an outrageous, not just error, but travesty, because it disrupted the doctor-patient relationship. So it'll have all sorts of other implications. But certainly it meant that no one in that context was giving informed consent,
Hmm.
because you can't give informed consent if your questions are not being answered, because the person who you're asking the question says, I'm not allowed to tell you the answer
Or I don't know.
because I'll lose my medical registration. And this, what patients were coming to me telling me, like this is what, I've asked so many doctors, do you think I should have this or not? And they're telling me, I can't tell you that, because if I do give you that advice, then I might lose my medical and many doctors in Australia did lose or had their medical registration suspended. So this wasn't an idle threat; it was actually carried out. And only now, 5 years later, are some of those doctors getting their medical registrations back after not being allowed to work for 5 years, because they made a comment on social media about vaccines and vaccine technologies, or because they told a patient, look, I think in your case, I don't think the benefit outweighs the risk, and they got reported, not usually by the patient, but by a relative or by a nurse
Right.
who was in the room who witnessed it.
Right.
They got immediately lost their medical registration for telling the truth. I mean, it's outrageous, and yet, as I say, that was what happened, and that's why the public have no confidence left in public health in these countries, because they saw what happened was a system wide, you know, approach that was everything that public health shouldn't be.
Quite a
It was
change.
draconian. It had no scientific basis. It breached civil rights. It interfered in the doctor-patient relationship. It's everything that should never have happened. And yet that's what happened. And it was done at a whole country level. And in fact, almost at a global level.
Quite a
And that's why to this day people have lost confidence. And you have to understand why. Because it wasn't just an individual rogue, you know, public health person or rogue chief medical officer. This was like a decision
This was
at the highest levels of the medical system across multiple countries that they were going to take this action.
how would you like to encompass and summarize this entire topic until we come back next Monday with a brand new topic?
Yeah, just to remind people that vaccines are really a wonderful invention. And although, they're like all technologies, there will be ups and there will be downs. Let's not throw the baby out with the bathwater. The measles vaccine, has done a tremendous job, and with every time there's a drop in measles vaccination, we get outbreaks, as we're seeing now. We've had them in Australia, we've seen them in the US. I mean, during the collapse of the Soviet Union, vaccination rates dropped, and they had massive measles outbreaks and many deaths of children. And then they reinvested in public health, got the vaccination rates up, and the measles again was extinguished. So anyone who suggests that the measles vaccine doesn't work isn't speaking from a position of authority. I mean, it's an extremely successful vaccine, a very safe vaccine, and measles is a terrible disease. Having almost died from it myself as a child, apparently. And having measles encephalitis, I can tell you, the measles is a breakthrough. So yeah, we have to start every conversation, I think, by acknowledging just what an amazing achievement vaccines have been. But that isn't to say that we can't continue to look at ways to improve them. And in order to improve them, we have to be honest about where they might have deficiencies or they might have weaknesses. It's very important that we are open about that in order to actually move forward and make even better products. So conversations like this are absolutely essential, I think, to reassure the public that vaccines are good, and we're always trying to make them better.
And connect more with the people and communities on ground. Discuss these.
Look, as I say, we need to re-engage and give the nurses and the general practitioners and the people in the field the authority to be the ones who discuss this with the community. It can't be done from centralised authorities. We can no longer have what we saw during the pandemic, where we have centralised control and messages all coming centrally, because the public don't trust those messages, and those messages may not be relevant to many members of the public. The people they do trust are not the chief medical officer or some epidemiologist, at a university. What they trust is as you say, the medical and health practitioners who they're dealing with on a daily basis. So we need to re-empower those people and tell them, look, you have the power to discuss this with the patient, and whatever you discuss is sacrosanct under the doctor-patient relationship. Maybe you tell the patient they shouldn't have a particular vaccine. That's your right as a doctor, just as it's your right to suggest they have a drug or not have a drug. Vaccines are no different. So we have to re-empower the health professional in the field, as you say, the one who's in contact with the patient ultimately has to have the power to say what they think and share their knowledge with the public. And then I think we'll bring the public back. I don't think anything else will bring the public back.
Dr. Petrosky, we're out of time. What a fantastic discussion, and the way you've really gone through the layers of this very complicated topic. I'm personally grateful for educating me. Thank you very much.
Always a pleasure.